So, thank you for coming this afternoon. Nice to see you for faces. And as Debbie said, I'm going to talk to you about collaborative approaches to public engagement. I'll introduce myself for those of you in the room who don't know me. I'll try to. I'm responsible for communications and impact for the Scottish Learning Disabilities Observatory, and I've been working in communications roles for 16 years now. And I've been, for the last 9 years, working in the weird and wonderful world of research communications and impact generation, which encompasses a large variety of activities, from policy and practitioner influencing to digital and traditional media engagement to public engagement in all of its forms, whether that's webinars, workshops, film, photo exhibition, conferences. The last 4 years I've been working with the Observatory. And for anyone in the room who's not familiar with the Scottish Learning Disabilities Observatory, here's a little information about the group. We're based upstairs in mental health and wellbeing, and the team are a multidisciplinary research group dedicated to improving health and wellbeing of disabilities. Our very talented team, some of whom are in the room today, look at the determinants of health inequalities. They devise and evaluate lifestyle intervention, and a programme of postgraduate teaching. All of this is with the overall aim of addressing the stark health inequalities faced by the population with learning disabilities. Our groups share research findings in a number of ways and engage different audiences with different approaches, including events, parliamentary consultations, evidence submissions, digital and traditional media activity, policy-focused discussions and briefings, direct engagement with clinicians and health and care professionals, as well as developing outputs with and for people with learning disabilities, carers and support organisations. So we use a very broad approach to engaging different audiences with our research. So according to the National Coordinating Centre for Public Engagement is the myriad of ways in which the activity and benefits of higher education and research can be shared with the public. Engagement is, by definition, a two-way process, involving interaction and listening with the goal of generating mutual benefit. So it's a very broad definition, and it encompasses lots of different types of activity. The emphasis on mutual benefit is one that I'll be picking up throughout this presentation. And I've called this presentation Collaborative Approaches to Public Engagement, and I want to start by saying that there are some absolutely brilliant examples of this going on across the school and across the University of Glasgow. So I'm not presenting anything that is groundbreaking, but I will be talking to you about some of the more specific ways that we've been approaching public engagement at the Observatory recently, what we've learned from this, and also hoping to draw out some of the more general, transferable approaches, which I hope will be useful to you and your research. So I'm going to start by talking a wee bit about storytelling and the value of storytelling. And as much as those involved in research know the importance of it, sometimes you need a good story in order to connect with new audiences and help more people to understand your research, its relevance and its implications. And, you know, in a lot of cases, who better to tell the story than the people your research is about or for whom it may have the biggest impact? And across the University of Glasgow, you know, there's a huge focus on addressing inequalities, and a great deal of the evidence generated by colleagues here at the Observatory highlights huge inequality, such as the fact that people with learning disabilities die up to 20 years younger than people without learning disabilities, often from avoidable and treatable conditions. And this is shocking and it's unacceptable, and yet the health injustices experienced by this population are often overlooked or under-acknowledged in society. So lived experiences can help to humanise statistics, facts and figures, and hearing about a person's experience, for example, of stigma and discrimination, or of health inequalities, can help wider audiences to understand the real world impact of some of our research and can make it harder to ignore. The point I'll be returning to throughout the presentation is that people with learning disabilities face barriers to engagement in research that seeks to identify, influence and address their health needs. So for us specifically as a research group, a key aspect of our approach to engagement is about including self-advocates and creating opportunities for participation in research and in engagement with research. And in developing and expanding our approach to inclusive research engagement, we've benefited from input from self-advocates with learning disabilities who challenge assumptions and provide fresh and alternative perspectives to some of the more traditional academic approaches to communicating research, which, as we know, can be quite exclusive, can be inaccessible to many. And I'll be coming back to say a bit more about that shortly. So as an example of a collaborative approach to public engagement using storytelling, I'm going to talk to you a wee bit about a project called This Is Me, Valuing the Lives of People with Learning Disabilities, which was a public engagement campaign that we ran from May to December 2022. And the inspiration for This Is Me came from a much earlier project led by colleagues at the Observatory in 2018, which was before my time here. That project was called Research Voices and involved a group of adults with learning disabilities from the Greater Glasgow area, working with colleagues from the Observatory to create a citizens' jury. And they came together to discuss their views on health research and to identify 10 recommendations, reducing barriers to research and challenging some of the health inequalities faced by people with learning disabilities. And one of their recommendations was that there should be a campaign around the health of people with learning disabilities, and this campaign should raise awareness of the poor health of people with learning disabilities. And these are quotes from the group. The campaign should talk about how to make things simpler for us and to change people's ideas about us. And to take this recommendation forward, my colleague, Professor Deborah Cairns, came up with the idea, which we then developed into This Is Me, Valuing the Lives of People with Learning Disabilities, which was a social media campaign foregrounding people with learning disabilities, family members and carers, sharing their stories and experiences as a series of short films in order to highlight stigma and discrimination. We developed a funding application in collaboration with some of our third sector partners and self-advocates with learning disabilities, and were successfully awarded Glasgow Knowledge Exchange funding. And this project was the first for the Observatory. We were aiming to engage more broadly with very public audiences beyond our usual informed or interested publics. The stakeholders for the Observatory usually include professionals, policymakers, advocates, those who are working in the learning disability space. So with this project, we were aiming wider, hoping to raise awareness and encourage public audiences to think about some of the attitudes towards people with learning disabilities and how these can link to health and social inequalities. And yes, we were very mindful that this was quite aspirational in terms of the vision to change attitudes, and that is a huge challenge, and it's a very difficult thing to measure, and it takes years and it takes millions. But at the time, as a collective, combining lived experience, third sector expertise and academic evidence, we felt that we had a strong position to add our voices to this arena and encourage people to think about attitudes and values around people with learning disabilities. Here's one of the short films from the campaign where you'll hear Cher talk about some of her experiences and the changes that she would like to see.
Sorry.
Oh. So I'm going to talk a wee bit about that campaign and what we did with the help of some really excellent filmmakers, a company called One Caliber. We created 6 short films interviewing self-advocates, family carers and colleagues from third sector organisations. And the format was very organic and conversational, and while it had the broad focus on stigma and discrimination, interviewees also highlighted aspects of their lives that they wanted to share. And again, this was about hearing from people about their individual experiences, with their stories grounding research in the real world, which we hoped would help wider audiences to connect with and understand some of the research. To share the films and blogs and other outputs, including poems, we used our social media channels, as well as working with the university's central communications team to push content out via their channels. And we used the hashtag #ThisIsMe22 to encourage and to track engagement. And with our social media posts, we're hoping to prompt conversation and increase awareness and encourage people to tell us about how they value the lives of people with learning disabilities. We were also able to get some traditional media engagement, resulting in coverage on this about This Is Me on STV and BBC Scotland. As this is a seminar, which is part of a skills series, I'm going to say a quick word about the importance of measurement and evaluation. And this wasn't meant to be animated. This is a transferable principle for all public engagement, knowledge exchange, or impact generation activity. You know, evaluation helps you to understand the reach of your engagement. You know, how many people have you connected with? Who are they? Where are they? What's their demographic? And the significance of your engagement. You know, what's the outcome of that engagement? What has changed or been influenced as a result of their engagement with your research? You know, to help you do this, free analytics tools are your friend. You know, social media channels and Google Analytics are all available, and they can give some really useful insights into things like web traffic increases, likes, follows, reposts, and whatnot. And, you know, a useful thing to remember to do is take a measure of those before your public engagement activities so that you have a baseline from which to measure any increase, any change of, you know, and that will help you measure reach. I would say, keep in mind that these offer a measure of reach and engagement, but not the whole picture. It's important to identify what you want to measure and the tools that will help you to do this. So for example, with This Is Me, we wanted to know how many people were engaging with the content and how. And I approached the University of Glasgow social media team to help us with that, both to push content out, but also to measure it so that we were actually able to access, they have a paid for tracking tool, which helped us with a bit of measurement and analysis of our engagement. So that involved a wee bit of internal collaboration there to help amplify and measure our activity. And we also wanted a snapshot of, excuse me, we also wanted a snapshot of data to understand a bit more about public understanding of and attitudes towards learning disabilities. So we actually commissioned a short survey of 1,000 people across Scotland, split by region and different demographics. So just thinking about what you want to measure and why and how you want to measure it is just a really important thing to keep in mind with all public engagement activities. Back to This Is Me briefly, just to let you know, how did it all go? This was, as I say, the first public engagement campaign for the observatory, and with This Is Me, it had the highest level of engagement for any activity since the observatory was established in 2015. And on screen is a quick summary of some of our digital engagement. And I think another really great kind of legacy for the project was that NHS Education for Scotland are now using the films in a new training resource for all health and social care staff across Scotland to learn more about learning disabilities. So that was quite a good impact outcome for the project. And what does all of this mean in terms of, what do some of these figures on the screen mean? We feel that, this means that through that coordinated approach, through, expanding our reach beyond our usual stakeholders and engaging with wider public audiences, collaborating with internal and external partners to bring it all together and to amplify it further, we were able to engage with new people, new groups and new organisations. And for us, this means that more people are engaging with that conversation around stigma, discrimination, and health inequalities experienced by people with learning disabilities. At the end of the year, in 2022, we held a workshop which brought together people with learning disabilities, carers and supporters. It came together to reflect on the campaign and what we'd learned, what we'd achieved. And we also wanted to discuss as a group what changes people wanted to see to make Scotland a more inclusive place for people with learning disabilities. And if you've been in the Buyers Community Hub recently, you might recognise this lovely graphic that's up on display. And as a research observatory, we reflected on what we could do as part of the call for action that came out of that workshop. Some of the recommendations from the group were, again, about creating more opportunities for people with learning disabilities to be involved in health research, to make health information easier to understand for more people, and to break down some of those barriers to inclusion. And we reflected on the role of the University of Glasgow and identified that we had a unique opportunity to try and take forward some of the recommendations from this group. And this leads me on to talk to you about another example of collaborative public engagement with research, a project called Research for Everyone. So in 2023, following another brilliant idea from Professor Deborah Cairns, she's the ideas person, we were again awarded some funding by the University of Glasgow Knowledge Exchange Fund to conduct a pilot project where we worked with a group of self-advocates with learning disabilities, third sector partners, and research colleagues working in different areas of health to translate complex research into easier to understand outputs. And this project is Research for Everyone. As it says here, we feel quite strongly that everyone has the right to meaningful health information. And at the observatory, we routinely translate our outputs into accessible information, making our outputs accessible to people with learning disabilities through things like easy read formats or video. And we also produce lay summaries so that the findings can be understood by broad audiences and non-expert audiences. But with Research for Everyone, we wanted to take this approach beyond translating learning disabilities research, so that we could encourage a more inclusive research approach across the university, encouraging colleagues to consider the way that they communicate about important new health science to different audiences that might include people with diverse communications requirements, children, young people, older adults. And again, this is important because health research is typically written in very technical language and is not accessible to people outside of that specialist area. And this can lead to people for whom this work is really important and relevant being left out of the picture. And we wanted to try and address that inequality with this pilot project. And we know that people with learning disabilities are experts by experience and have valuable insights in how to make information easier to understand. On the screen are some quotes from some of our collaborators on Research for Everyone. Natalie and Aaron, who are self-advocates, and Jenny Miller, who's the Chief Executive of PAMIS, which is a third sector organisation who support and advocate for people and families of people with profound and multiple learning disabilities. And I think all three make really important points here. And I was particularly struck by Jenny's point about making research usable. As a research community, it's important that stakeholders use research findings. This needs to happen in order for research to help facilitate change and lead to impact. And, as a key step in this process, it's important that research is usable by different groups, and that includes making it more user-friendly for diverse audiences. And as I'd mentioned earlier, engaging public audiences with your research can be a mutually beneficial process. Aaron's quote makes the point that people outside of academia, perhaps those who might typically experience exclusion from academia, people get to learn by taking part in research, get to learn about and potentially contribute to new important information, such as health science. At the same time, researchers get to learn from people with lived experience about what these findings mean to their lives and the difference this can make. And, as a research community, we get the benefit of hearing alternative perspectives and considering different ways of communicating about these important issues. So for this ambitious project, we had a group of collaborators which included 6 self-advocates with learning disabilities. We had 2 research colleagues from across MBLS whose papers that we were translating. We worked with an animation company called Media Co-op, and Deborah cared some of the observatory team and myself to manage and deliver the project. And it's really important to emphasise that all of the creative decision-making was led by self-advocates and Media Co-op. And again, we benefited from the expertise of everyone involved who really questioned some of the academic jargon and helped to clarify and really distill some of that important health information. We translated 2 studies as a group. One was on the impact of living with cancer on mental health, led by Dr. Claire Needvich, and one was on the links between heading the ball in football and the development of brain disease, which was led by Dr. Emma Russell. And we created 2 short animated films, 2 podcast episodes, and 2 A4 infographics. And again, if you're passing through the Buyers Community Hub, these are all on display at the moment, so go and have a look and a read and a listen. I think for me, it's important to highlight again that this was another new approach for the observatory. We were taking forward some of the principles of inclusive practice learned from other observatory projects and using these as part of a creative process. We're translating non-learning disabilities research and collaborating with colleagues from across the university, which again offered great benefit for everyone involved. And we were creating outputs to engage audiences beyond our typical sphere of reference. And I'm reiterating this point about the newness of this for us as a group, because I'm not holding this up as a perfect gold star example of how to, but more of an example as a piece of work where trying something new with public engagement turned out to be very rewarding and developmental all round. And just hopefully that's something that's quite encouraging to you. And I'll talk a bit more about that later. As a break from listening to me for 2 minutes, here is one of the animations that the group created, which includes a BSL interpreter. And some of you might recognise the voice of our narrator, STV presenter Laura Boyd, who very kindly supported this project as she has personal and professional interest in this research. So these outputs were launched online in October 2023. And we launched those, across all of our social channels and those of our partners and networks too, and had a couple of pieces of media coverage to help share the details of the project. And again, it was about making a really big effort to spread the information far and wide across digital platforms and also at public engagement events to share them in person. And that meant that we could connect with diverse audiences and get their input on the outputs and on the approach that we were taking to develop them. Again, I'm going to talk a wee bit about measurement here. As this was a pilot project, we needed to understand what members of the public thought about the outputs, as well as identifying whether researchers felt that they were a worthwhile approach. We used several different evaluation tools. We had an electronic survey, which included a subsection for researchers, and we also created an easy-read, downloadable questionnaire, which meant that people could discuss and give feedback in groups or with the help of an advocacy worker. We had a short, simplified survey, which specifically targeted youth football clubs to gather data about football and brain disease animation, as we felt that that might be quite a useful group to test out those outputs with, really kind of helping football fans to understand some of the science behind the headlines. And for our in-person events, we used a very simple paper survey to capture some on-the-spot feedback from members of the public. And, we had people attending public engagement festivals where we were sharing this, who, aged 8 years old to 70 years old. So quite a range of people engaging with the outputs. And for us, and certainly for me, another really important a really important aspect of the process was to understand more about the process itself, and how our collaborators experienced the process being part of it. So I undertook a series of short interviews to learn more about what it was like for collaborators to take part. Did they feel included? Did they feel listened to? Did they feel valued? Why did they feel it was important to be part of the project? And also what kind of things could be improved for next time? Here's a wee snapshot of some of the reach of Research for Everyone to date. We've reached over 130,000 people online, and that includes people in Australia, Africa, parts of Europe. We've had a relatively high number of survey respondents. It's very hard to get people to respond to surveys. So we felt quite proud of this number in the short space of time. And that featured quite a good cross-section of different public audiences that we were hoping to engage with. Young people, adults, people who identified as neurodiverse, people who identified as having learning disabilities, who identified as having learning difficulties, and researchers. And I'll not bore you with the statistics, and if anyone wants to know more about our evaluation, I'm happy to talk about it offline. Overall, we felt the feedback for the project was very positive from those who engaged, including 25% of respondents being researchers, 96% of whom told us that they would like to make their research findings easier to understand, to engage non-experts, to engage the general public, children, young people. So we've got quite a lot to do to take that forward for Research for Everyone. Again, here are just a couple of views from some of the people who took part in the evaluation, having engaged with those outputs. So I've shared 2 recent examples of collaborative public engagement with research. And a few things that these have in common are, the use of storytelling via interview or animation to bring facts to life and to help broader public audiences to engage with research. They both involve working directly with stakeholders who are impacted by the research through sharing their experiences or including them in the creative process. And I think these approaches have engaged with public audiences on a few different levels, in the co-creation and the development, but also with the outputs, the activities and the evaluation. And coming back to the point about mutual benefit, researchers have really benefited from the challenges to the traditional academic way of sharing findings, from rethinking language and tone to really being pushed to distill key findings into useful health improvement messages. And participants who may not typically have engaged with research have had the opportunity to contribute their expertise and to build new skills and confidence. And, returning to the very broad definition that I shared at the start, There are so many forms of public engagement. You know, here at the Observatory, we found that working in this inclusive and collaborative way has helped us to reach new audiences with our research, to build confidence internally for University of Glasgow staff, as well as building skills and capacity for some of the self-advocate contributors. And again, because this is a skills series, here are a few things to think about on how you might get started with public engagement with research, or in trying something new with your public engagement. You know, really reflecting on, as a starting point, what are your impact objectives and what are the changes that you wish to see as a result of your research? Identify the different groups that your work is relevant to. Who needs to know about your research and why? What do you want to achieve by engaging with these different audiences? Are there any gaps in your stakeholder map where you could be increasing your impact potential? Lots to think about there. Also, resources are finite, so, you know, be strategic, start with something manageable, give it a go and evaluate it. Another thing to say is just don't be afraid to ask for support from people who can support to help amplify your engagement. There is lots of support and there are lots of resources across the University of Glasgow. You know, really taking this as an opportunity to plug those brilliant resources and support for public engagement that does exist across the university. There are so many opportunities for public engagement, from here in the Buyers Community Hub to other annual festivals like Explorathon, Pint of Science, Festival of Social Science, plus all manner of external opportunities. There's also funding available to support public engagement, and you can find out much more about all of this, including all the network of brilliant professionals working to support public engagement, knowledge exchange, impact and research communications across the university. Lots of ideas, lots of templates, lots of case studies to really kind of inspire your approach to public engagement research. All available there, and kind of rippling out from there, you'll find lots of information. I am going to stop talking. Here's where you can find out a wee bit more about the two projects that I shared and how to contact me if you would like to. And also, please do give us a follow on any of those social media platforms that we're on. Thank you for listening.
Does anyone have any questions for Fiona? And I'll make sure I've got chat. Any questions in the room? Yep, over here.
I've just got a question. Apologies if I missed it in your talk. So the surveys you were talking about in the second project to evaluate, how did you publicize that where you got 150 respondents? I missed how you publicized the surveys.
So all online, as well as in person at public engagement events. But yeah, we had a digital survey, or a few different versions of a digital survey, as well as one that was an easy read version that was downloadable from our website that encouraged different organisations to use. So yeah, it was largely digital. Using Qualtrics, as the university has, it's available to staff and students to use. But yeah, it's a Qualtrics survey that tested quite significantly before putting it out publicly to evaluate. And what's good about it is that you can have sections and subsections. So we wanted to really capture data about how researchers felt about the outputs and the process, and whether they would consider a similar approach to sharing their research findings. But not everybody would have identified as a researcher. So it's quite good that you can kind of filter the questions, the survey, to suit the audience, if that makes sense. So we found that to be quite a useful way to do that. Any questions? Susan.
When you mentioned at the end there all the support that's available, but it'd be amazing to have your presentation as part of those resources.
I'll share that, thank you.
And if you were too shy to put it on the team.
Thank you. I think someone in the chat also asked if the links would be available. Yeah, sorry, it turns out that people in the Zoom room weren't able to hear the audio for those films, so I'm sorry about that. I wasn't aware, but absolutely, I can share links, and the QR codes actually on screen also will take you to the web pages where you can find the resources, which will have sound. Hopefully. Just going to check. Are there any other questions in the room? Zoom room. Hi.
You've done a fantastic work, that's amazing. But just to come back to the public engagement, and that we're just part of it. How do you what is the best way to evaluate this?
So the publication, the in-person events, do you mean?
Exactly, the Explorathon, for example.
Yeah, so we participated in that as a much, you know, that's all. So Explorathon was led by, it was based across in the Arc and led by colleagues who work in public engagement at the university. So we individually didn't have a huge amount of input to how that was evaluated, but I do know that they do have quite a robust evaluation process, because, you know, we need to be able to evidence that people are attending and engaging with something like Explorathon so that we can continue to have funding for that year on year. So those do exist, but I'm perhaps not the best person to tell you exactly what their evaluation measures are. But for our individual stall, where people were coming to us to engage with Research for Everyone, we had paper, we just did a really short, simple paper survey with questions, you know, what do you think of these? I can't even remember what the questions were, but it was a really, to get a snapshot of in-person, on the spot response to the resources that we were sharing, and a wee bit about whether they thought that it was even worthwhile to make academic papers available to audiences. So it's about what do you think of this in front of you, but also what do you think of this as an approach? There are a bit of mixed information there. I'm sure we could find out more for you about how Explorathon and Festival of Social Science are evaluated at the college level. I'm sure that will be available somehow.
How did you know you were able to use that overall evaluation for your,
Yeah,
you know,
yeah,
for your environment?
yeah, kind of all counts to be able to demonstrate reach and significance of the engagement. So, yeah.
Thank you. Pressure now. I just wondered how you chose the topics that you portrayed, the mental health and cancer.
I'm gonna hand over to my colleague Debbie to answer that question.
Yes, we wanted something quite complex because we wanted to give ourselves a challenge. So we thought, what are two very difficult areas to look at? And we had colleagues within the School of Health and Wellbeing who were putting forward suggestions for us. So we talked about neurodegenerative disease, and just to even say that was complicated enough. And having read the article, I thought that's really complex. How do you translate something really difficult like that conversation? But then because it had a topic of football, we thought that could be really engaging as well. So that was why we chose that one. And then the cancer and mental health one, we were also thinking about using different methods. So the neurodegenerative disease paper was looking at data, big data sets. So that was another reason why we included that. And then the paper on cancer and mental health was a systematic review. And again, we were having conversations going, how do you define a systematic review? So even for the academics, we're like, it's gathering lots of different papers, and because we've had conversations with self-advocates before when we're talking about research, and that often came up, was about, well, what's a systematic review? How's that different to just looking at some literature or research out there? So we thought that would be quite a good one as well. And cancer affects so many people. We thought that might have, and mental health, that might again be something that people are really interested to know a bit more about. We'll go with Andrew next, and then
Mike.
Thanks. That was a fabulous talk, and really brilliant and innovative, exciting work. I mean, something we've talked about before, and I was just going to ask you about this, if you had any thoughts, Fiona, which is around the issue of being a kind of Luddite social media work. And for something like stigma, where you're trying to get people who may not be people who pick up and use those kind of media, or not click on those kind of issues, how do you broaden it beyond that in order to reach people who are the people who maybe need to listen to these messages most?
I think that's a really good question and a really, really big challenge. And what I would say is, you know, the two examples that I shared there did rely very heavily on digital media and on people being engaged and themselves as users and consumers of media. And you're absolutely right, thinking about populations of people, groups who are not typically engaged with research or typically engaged with social media are, yeah, it makes it tricky to engage. I think, I mean, there are lots of ways of doing that, but it's about, I think, embracing networks that you have and the partnerships that you have and the networks that they might have to kind of to come together to come up with ideas. How do we get people together? How do we get them to connect around a subject? How do we communicate non-digitally? And that can involve focus groups, workshops, inviting people to come into the community engagement spaces that we have here in the university, for example. But yeah, I think a lot of it is about networking with your existing partners and people who you're working with as part of your research to engage them in that process to how to solve that challenge, because it's difficult.
It might cause some confusion, but the other bit is that, and again, correct me if I'm wrong here, but very often people on social media will go to areas they're interested in or they have a focus on. And it's some people that don't focus on these issues or aren't interested in the very people you're trying to get. So how do you, in that digital sphere, try and get to those people? So for example, people who maybe those who are going to give people like share a hard time because they don't understand that people then notice they're not inclusive. I mean, how do you, and so may not be interested in those areas, how do we try and get to them in the digital space?
I don't think there's any one way to do it. And I think, interestingly, not from my research communications background, but from several lifetimes ago when I used to work with Samaritans and did a lot of work, public affairs work and communications work. And suicide prevention and suicide as a sort of an area is something that very closely linked with stigma and as a subject that people find difficult, lots of reasons to talk about. Also the way that media have a role to play in changing the narrative around suicide and actually engaging with broadcasters and people who are so broadcast television and storylines and changing narratives in that very kind of broad way. People watching Coronation Street would see a storyline and it would tell, it would change the narrative around suicide. For example, that's long-term work, but it makes me think about, where are people receiving information? Where are people connecting with information that's not their kind of sphere of reference or their echo chamber? And I don't have one answer to that question, but I think it's a really important challenge that is something that we all need to be working to think about how to overcome that.
My question falls quite nicely on, actually. I was thinking about your social media engagement and if you had experimented with or considered using any multi-posts or boosted posts on Facebook, Instagram, and Twitter. And this was the second part of that would be that then allows you to target the posts more accurately, and then there was papers of research done which describes the variables which would make you more likely to be have negative attitudes towards people with disabilities. They use that to balance and it produces quite high engagement rates for relatively people. I was wondering if you looked at that at all.
The short answer is no, but I absolutely agree. There's huge potential to actually engage with people who wouldn't normally engage with research or wouldn't normally choose to pay attention to certain messaging, or that would be a way to engage with people. The reason we haven't had the opportunity to do that often comes back to budget and resources and actually the broader focus of what we're trying to do. But I think had we time to do a discrete piece of work where we'd be able to identify the gaps, in here's who we do know is interested, here's who we do know and is engaging with our research, and we know a wee bit about how and why. But what you're talking about, I think, is the gaps in the knowledge and also, so I think using digital and using social media and using all of the information that you could glean from that to help identify those gaps and therefore connect with people would be a brilliant piece of work to be able to do. It's not something, I don't know if it's something that we will do, but it's, I think it's, there's lots that could be done, definitely.
Yeah. Any final questions? Any questions on?
I don't think so. No, I think I'm.
Okay, thank you very much, Fiona, and thanks everyone for coming along today. You can go.